You're listening to the Brave Parent Podcast. I'm your host, Dr. Susan Maples. I'm here for all parents who deeply love their children and want their health span to equal their lifespan. In other words, to be healthy their entire lives. If that's you, tune in. In every episode, we're grappling with contemporary issues that affect every child every day in areas that your doctors either don't know or don't have time to tell you. It's your time to be brave. Hi, everyone. It's Dr. Susan Maples back for a Brave Parent Podcast number 5. And today we're going to talk about breathe, which is such a critically important subject. In fact, so important that I really wanted to put it as the first chapter in the book, because I sort of feel like, well, you can survive without food for 3 days for 3 weeks, and without water for 3 days, but without oxygen for 3 minutes. So really critically important, our number one nutrient. But I didn't put it first because one of the pre-readers was my good friend, Dr. Robert Lustig, who's author of Metabolical Fat Chance and Hacking the American Mind. And I love his opinion of it, which said this was probably the more complicated chapter of the book. And we wanted to start you off with some confidence of something you already know about, which was food, and then drink. Digest got a little more complicated. This gets a little more complicated. In my world, it seems so simple for me because I look at faces and noses and mouths and tongues all the time. But for you, it might be new concepts about why we have so much breathing disorder and sleep disorder in adults, and what we can do, again, to wind the clock back to look at kids. Because when I look at 26% of the adult population being sleep apneic now, having some sleep apnea, and only 4% are diagnosed, by the way. Most of them don't know that they're at such high risk for heart attack and stroke. I think, what could we have done way back in the beginning to prevent the growth and development that leads to obstructive sleep apnea? So just to clarify, this chapter is about breathe, which is all about facial development as it relates to nose and mouth breathing. And then we'll move into the next chapter, which will be another podcast on sleep. And that includes sleep-related breathing disorders. But you'll see how very much they're connected. So, of course, we won't get through this podcast without talking about sleep a little bit. Right?
There's just no way. They're, like you said, they're too connected. So,
Lauren, share your experience when you first read this chapter.
This was mind-blowing for me. Even in the sense of, like, we breathe all the time, but we're not really thinking about the right way to breathe, or if there's a right way to breathe. I recognized right away that I was a mouth breather, and I never knew that was a bad thing. Just thought that's just how I breathe. This was very eye-opening. I started paying more attention to, my family, and then especially my kids. My kids right now are 4 and 6, and this was massive for me. And I think one of the biggest, and I because breathe and sleep are so linked together, I don't know which one this was in, but one of the scariest moments for me reading this book was that comment about how and you can say it better than I can, Susan, but about when a child is breathing and they have that like an airway blockage, essentially, right? And what that means, what's actually happening, is that it's almost like your child is being choked,
starved.
Yeah.
It is. Sometimes you do hear a choking noise. In fact, when it's interesting because we're sort of on sleep right now, but during REM sleep, which is rapid eye movement sleep, it's a very, very active time for the brain, but the body shuts down. All of our skeletal muscles become paralyzed so that we can't act out our dreams, which turns out is a very good thing. But when you're paralyzed, oftentimes, whatever your resting tongue posture is, if it blocks the airway, you can't breathe. So you wake up to offload carbon dioxide and take in a breath of air. And the constant waking robs you of sleep. So we're going to talk more about sleep deprivation and oxygen deprivation during sleep again later. But how do we create mouths and throats and tongues and faces that support good airway health, even while we're sleeping, during rest posture when our muscles are paralyzed. And that happens during, believe it or not, during infancy. Our brains are little, like our little skulls are literally like 25 to 33% of their adult size at birth, which is super good because it has to make it through the birth canal. But it grows to about 80% within 2 years.
Mhm.
So think about that. The facial development of your baby depends on muscles.
Mhm.
Muscles always win. Muscles shape bones, right? They shape bones. So if we walk around slumped over like this with bad posture, our bones will go that way. If
Mhm.
we walk around like this, our bones will grow that way. Muscles always have shaped bones. So when we're looking at the tongue, which is like 16 muscles coming together, powerful enough to spread the palate and bring the face forward and bring the airway, the throat opening up and forward to create a nice big fat tunnel back there from the tip of the nose down to your lungs, down through here. It's super critically important that we get babies sucking from the beginning from a breast if possible.
Mhm.
And we'll talk about why that suck is so important in a minute, but it's super important right from the start that we give kids, that we recognize disorders in sucking and swallowing and breathing, and that we figure out how to fix them
Mhm.
early in life.
And I think the big thing is, like, again, going back to the me mouth breathing and being able to see it in my children, one especially who's been congested for weeks now, right? And the mouth breathing is just getting worse and worse and worse. And um number one is recognizing that that's not normal. Like that should not be accepted like it is. If your child is mouth breathing, there's a problem that needs to be addressed.
And you know how many people on YouTube have put on cute, if I put cute
Mm,
snoring videos, they think
yep.
it's funny.
Yep.
Not funny.
Mm.
Not funny. Not funny at all. So when we think about this, babies are born what we call obligate nose breathers. If a baby, now in our sort of advanced civilization, we can keep babies alive no matter what their dysfunction is. But think about this a couple hundred years ago.
Mhm.
If a baby couldn't suck from a breast and swallow while they were breathing through their nose, they wouldn't live.
Mm.
If your mouth is consumed with sucking and swallowing, you have to be able to breathe through your nose.
Mm.
So we're born with the ability to do that,
Great
which is
point.
awesome. And by the way, you have to work up to 60 times harder to receive breast milk through a breast than you do from a bottle.
Mm.
So if you are breastfeeding properly, your muscles get nice and big, just like you were working them out.
Oh.
If you have a bottle that basically just flows milk easily through your mouth, where you don't have to work that hard, you don't work that hard.
Mhm.
Your tongue doesn't develop into that big, powerful musculature that shapes the face, and it sits low and lazy. And because of that, the facial muscles push in and narrow the jaw bones. So the narrow jaw bones means that we don't grow forward and we don't grow laterally or widthwise. And then we, of course, the shape of our jaws gets more constricted and the teeth get more crowded. Show me a kid who doesn't need braces from crowding teeth these days, right?
Absolutely.
A lot of that is because we
And
don't
normal.
suck, we don't suck for a couple years on breast, and we also don't transition to real food. We start to feed kids pureed food out of jars and pouches where they just suck it. It's like they're not even having to chew.
Mhm.
So this whole area of baby-led weaning, where they're eating the food you eat, only they're mashing it with their gums and you're making it. So you have to look at baby. I don't know if a lot of people know what baby-led weaning is, but it's really gaining in some popularity. What we notice is that the lack of breastfeeding and the lack of eating real food and the mouth breathing in general, instead of nose breathing, has caused a thwarted development of the face. So little kids' face, instead of developing forward like that line or like this line, they're retruded.
And for those of you who are just listening on the podcast, in Brave Parent, Susan actually has some really great diagrams where you can see this. What pages are those on, Susan?
That's 142 and 143.
142 and 143. You can actually also see the video of this recording on Be a Brave Parent Facebook and Instagram. So you can see the diagrams that she held up. They're very helpful.
You yourself, Lauren, if you take your finger and put it on your nose and put it on your chin, and then just rest. If you're see how her upper lip is not, you're pushing it out right now, but when you were just resting, look at how that angle is. Her chin is retruded, her upper jaw's sort of set back. So really her face is retruded from her habitual mouth breathing. Now, how does mouth breathing occur? First of all, the nose has all the magic, right? The nose is amazing. It has these little caverns, caves called turbinates that sort of purify, warm, humidify, and in that purification process gives off something called nitric oxide that literally sifts through all the little hazards that we breathe in and sort of gets rid of them for us. And then we breathe in clean, purified, humidified air. But if we skip the nose and go right through the mouth, we don't have that ability. The mouth is not magic at all for that. Mouth is for chewing and for eating and not for breathing. So if we skip by that, all the impurities in the air are literally, you're relying on the lymph tissue, which is the tonsils and the adenoids, to sort of take care of it. And because of that, they hypertrophy or overgrow. So you get large tonsils and adenoids. So not only are we getting the thwarted development of the face, but now we're getting increased soft tissue blockages back there. And that becomes a real problem for breathing. So throw all that in of the retruded face with the increase in blockages in the back of the throat. And now we have a habitual mouth breather who's suffering to sleep at night, and all kinds of behavior issues that come with all of that.
Yes. And that was another really fascinating piece for me from this, is just the thought of behavior issues for children stemming from breathing issues. The connection there was just mind-blowing, and it makes so much sense when you're reading your book and any material related to it.
And if you're wondering if your child suffers from some of these behavior symptoms of airway disorders, here's what they look like. Bedwetting, and there's a whole reason for that. We could talk about that if you're interested. Restless or fitful sleep, night terrors, anxiety, learning disabilities, aggressive and defiant behavior, slowed growth rate or delayed milestones, failing memory, poor decision making, lack of focus, including a misdiagnosis of ADD or ADHD. 37% of ADHD is really a sleep and breathing disorder rather than truly the attention deficit disorder, and depression. So ADD and ADHD have, by their symptomatology, the same top 5 symptoms as a sleep-related breathing disorder, people who basically are sleep deprived, which is why it's super easy to misdiagnose that. But what happens when we misdiagnose ADHD is we put these kids on Ritalin or a stimulant like Adderall or Ritalin, which steals more of their sleep.
Yeah.
So
I think, yeah. And I know, again, it's this line, right, with breathing and sleep. And when we're going to talk about what this episode or next, if you're interested in this, definitely listen to the next episode, because it's just going to be a deeper dive as well. But what's really fascinating to me is that I know the times that I have brought to our family doctors anything related to the kids, like, hey, this is what we're struggling with. Like, very early on, we dealt a lot with, and we still do, but it's not quite as bad. How they're rolling around in their sleep all the time, they're moaning in their sleep, it's just a very active sleep. Never once have we been asked about how are they breathing? How are they sleeping? That's never been anything that they've ever checked. And we have good doctors, why we consider good doctors. But I think
Give
it's
them a
very,
copy of Brave Parent, by the way.
what?
Bring your doctor a copy of
It's
Brave
true.
Parent.
It's very true. And I think that's scary. I think that as a parent, like one of the biggest takeaways I feel like you can have from this is making sure that's one of the first things that you're looking at is their breathing and talking to the doctors about that if you don't know what to look for.
It's interesting to me that you can see a child switch from this normal, natural nose breathing to mouth breathing when they get a cold. That
Mhm,
makes sense, right? This is the emergency backup valve. If you can't
mhm,
breathe through your nose, you got to get some oxygen.
mhm.
What happens when the cold dissipates and the child doesn't go back to
Yeah,
normal?
yeah.
So here are a couple of things you can do to help your child focus more um, on, on nose breathing, getting that function back. You can, what you're doing right now, Lauren, you're touching your lips. You can reach out and touch your child's lips and sort of pinch them together. This is for nonverbal kids, kids that aren't talking yet, but you can talk to them about it. They're forming language, right?
Mhm.
And you can say, close your mouth. And when they get a little older, you can tap your chin so that they know to close. This is
Sure.
like a little signal we have, right? Close your mouth. And by closing your mouth, for those of you who are listening right now, just check your own posture. If
Mhm.
your lips are closed and your tongue is up high on the top of your palate, the entire tongue, not just the front of your tongue, but the back of it's up there too, and you're breathing through your nose, that's normal resting posture. So you need to be able to get your kid to practice that resting posture so it does become habit and the tongue finds its place to expand that upper palate and make a home for itself. We call this the tongue box,
And can you
right?
just stress that again? Because that was another one of my favorite pieces from this book, because I never thought about the posture of my tongue and what is right when it's resting. So, can you just stress that one more time? Because I think that's a huge takeaway.
Yes, the tongue literally needs to be up on the top of your mouth, and the tongue muscles build a home big enough for it. That's what expands that upper arch. But if your tongue can't fit up there, it rests low. And so the idea is that with kids, we want that tongue up. Well, we want all of us to have it up and forward. And if this isn't a book on adult problems, but if you have
Mhm.
a tongue that doesn't fit up into your palate, what can you do now? We can do expansion. We usually we're not able to get a lot of forward growth and movement, but we can do lateral expansion even for adults and myofunctional therapy. But let's look back and say, why wouldn't the tongue go up there initially? Well, it could be from a bad cold, like what I just said, but it also could be that the tongue isn't able to. What if the tongue is restricted, tied down to the floor of your mouth, and you miss it because, let's say, oh, you struggled with breastfeeding and no one picked up a tongue tie, you switched over to a bottle, your baby got bigger, there were no speech and development problems from the tongue tie. In fact, they can even make a point with their tongue, but they can't lift the back of their tongue up to take its place in the palate. One of my jobs as an airway astute dentist is to do lip and tongue release, the upper lip frenum, so that the baby's upper lip can flange out around the top of a breast to be able to suck well without getting blisters on the mom or the baby's lips. And the tongue literally coming out over the ridge where the teeth eventually will grow in to suck from the bottom of a breast, because if the baby can't extend that tongue up and out to do that, not only will they not be able to suck efficiently, but they also won't be able to develop the strength of that tongue to be able to expand that tongue box. So
Mhm.
those are things to look at. Later, if mouth breathing becomes a really a habit, we can start doing things like lip taping for kids who are old enough to take the tape off to be able to say, I need a drink of water, or can mom, yeah. So lip taping, which is also, again, signaling for kids to close their mouth. And we can help them clear mucus out of their nose so they can better breathe through their nose at night by doing some nasal rinsing with distilled water and that Neil sinus med or some other saline type mix. And also some xylitol spray. And I think we're seeing erythritol come on the market too to reduce inflammation in the tissues. But right now, the xylitol, like the clear spray that you can do to reduce inflammation in the nose, to be able to help with that. And again, tonsil and adenoid removal. We talked about hypertrophy of tonsils and adenoids getting large and obstructing, and it does help to get those out of there. But that doesn't fix the problem, right? The problem came from the mouth breathing. Just to get the tonsils and adenoids out, we still have a mouth breathing problem.
Yes.
And I was super excited, Lauren, after this book was completed. Of course, there's already things I wish we could add, but there's a new study coming out that shows early expansion, early orthodontics, like under, like 3 or 4 years old, expanding the palate, giving the tongue a better place to live, shrinks tonsils and adenoids. So instead of surgery, you can think about pediatric expansion of the upper arch, which is something we're really excited about. Avoiding surgery for kids and being able to fix the root cause of the problem rather than just taking the tonsils and adenoids out.
Yeah. And if you're listening to this as a parent and you're thinking about your child and you're having maybe, minor freak out because you're recognizing a lot of these symptoms in your own child, which is exactly what I experienced when we were going through this book. The best thing you can do is try to find an airway health trained dentist. Is that right, Susan? To get a full exam? Would that be the number one step you'd recommend for anyone concerned?
I absolutely would. And unfortunately, we don't have enough. Dentistry is where it's falling. We're clear now that dentistry is going to be the airway gatekeepers for kids. As you mentioned, your pediatrician didn't look.
Busy.
Sadly, in the 1700s, which is yesterday in the blink of an eye of the human race, right? We separated the body into systems and we gave all the systems to specialists. And the area of the mouth that the physicians never got to look at was the mouth. They don't really get any training in that. So that we can see all these signs in the mouth, but they're not used to even looking at what does a healthy mouth look like versus not healthy. So it's all of the airway issues that we are able to see, the structure of the tongue box, the function of the tongue, the palate really belongs to, and the throat belongs to the dentist, the myofunctional therapist, which is a subset of speech and language pathology and occupational therapy and dental hygiene. But these areas that physicians are really not astute about. So you really do want to find an airway astute pediatric dentist or airway astute dentist that literally, my dog's having having an airway problem.
Oh no.
She's 16 and she sleeps with her tongue out of her mouth. And I'm like, oh, she has a little airway issue. But I look at this and think we have a crisis here because we really want to break this cycle. The reason that we have 26% of my generation has obstructive sleep apnea is a lot of it because we were bottle fed babies. And it was back in the day when formula was touted to be better than breast milk. So because we were a whole generation of kids raised on bottles and pureed foods, we all had crowded mouths, lack of facial development. And then Tweed Orthodontics came in and said, we should just take out those 4 bicuspids and move everything back to make your teeth straight. A lot of people had 4 bicuspid extraction. So we took a very small tongue box and made it even smaller. And now that we're older and we lose some elasticity in our tissue, our tongues and the back of our throat are experiencing the collapse at night during those sleeping episodes. And that's how we really have this progressive problem growing on from upper airway resistance syndrome all the way to severe obstructive sleep apnea. So we'll talk more about all of that later, but what were you going to say?
No, I was going to say, I think that's one of the most important things to keep in mind too, as your movement behind, brave parent and what is being a brave parent. It's really seizing the control again behind some of these decisions and not just relying on your pediatrician or family doctor, and making sure that you're turning to the experts, the ones who fully know. And it's also expanding your mind to look at, different roles in new ways. So for example, a dentist doesn't just clean the teeth. That's not what they're there for. It's not just to keep your teeth white and shiny and cavity free, right? Like there's so much more that should be happening there that truly affects the overall health of your child. And I think it's important as parents that we recognize the importance of that role in our child's life and try to find one that truly does have that full breadth of knowledge that can help them if they're having those breathing issues specifically.
For sure. Interesting is as I look at you talk, Lauren, I can't help but notice, I'm going to show you things you don't know about yourself,
Oh.
overactive talus muscle and the tongue. No, I look at you, but one of the things that I think about here is that parents really want their kids to look like them.
Mm.
So if you're a mouth breather and you have, a little bit of a gummy smile when you have a high lip elevation, you're gorgeous. But I mean, there are things that I look at in you that I look at and say, this is as a result of, this is not genetic. This is not nature. This is nurture. This is how you were formed based on your habits. When you swallow, you struggle to make lip closure. I can see it in the mentalis muscle, all this stuff, the chin muscles here. Unfortunately, when you try to get your kids help with airway stuff, their face develops more broadly, more in the way that it should. And somehow parents don't recognize it because they go, they look just like me.
Yeah.
They think they're supposed to look just like them. Instead of saying, let's not look at the appearance of their face right now. Let's look at the behavior and say, are they tired? Do they have circles under their eyes? Which, by the way, is the collapse is the upper jaw pushing back on the plexus of veins that cause that lack of venous return. Do their eyes sort of half mask? Do they look, are they fidget when they're, they basically fidget to stay awake. Adults get sleepy during the day. Kids fidget, which is how they get that ADHD tendency, right?
Yeah.
So take a look at the behavior of your child, both during sleep and waking, and take a video at night of your child sleeping. To see if they're mouth breathing or nose breathing. And if they're making any audible noises, snoring or heavy breathing during the day or night, that's a breathing issue. That needs help, right?
Yeah. That's a good takeaways. This is, again, one of those topics. There's going to be a part 2, but also a part B will be in the next episode where we do take it further with sleep specifically and bringing that back to breathing still. So what are the 3 things that you would tell a parent to take action on today?
I would just really, really focus on the fact that nose breathing is super critically important and that we need to figure out how to make that happen.
What can you tell your child related to that?
Oh, I love that book that Kelly Richardson has, the stuffy nose book. It's going to be coming out anytime. And the whole idea that a child can participate in telling themselves to get their tongue up, to close their lips, and to breathe through their nose. So we can teach them that. I would also say pick up James Nestor's book, Breath, which is really on adult nasal disuse. The fact that if you don't use your nose, you lose it. We didn't really talk about that, but we get more mucus in our nose just by not using it. So, and then we looked at allergies in the last section and the chronic allergic problem with the goopy nose and why we have to use the mouth. So I think it's complicated. I think my number one thing is read the book, read this chapter. If this has piqued your curiosity on breathing disorders with your kids, I did my very best and I focused a lot on this chapter of trying to make it really understandable. Some very complicated areas understandable for you. And if you have questions, definitely reach out to me. Yes. I think the second thing is to be challenging your physician and your dentist, because we don't have enough of them trained in this area. So you need to ask questions to stimulate their learning too, and maybe buy them a copy of this and Rich Baxter's tongue tie book. There's some really good books, and we should put some references on our podcast too. But I think it would be a really good idea to help your dentist and physician get more astute on this, and then be open to early orthodontics before the age of 6, so that we can. Why do we have to wait until they're 6? When the brain is developing so much during that time, and oxygen needs to be part of the brain during development, or we lose IQ points, literally, these kids that are oxygen starved and sleep deprived do not develop to their full potential. They just don't.
It's heartbreaking.
So
Yeah.
it is heartbreaking. So we have to be open to being able to jump in and intervene, not just with tonsil and adenoid surgery, but literally helping create a bigger tongue box earlier and myofunctional therapy to be able to help a child use the tongue better, more fully, and develop better patterns. Once you learn to throw a ball a number of times, you got this pattern, you know how to do it, you know how you do it. Unlearning that and learning a new way of doing it is difficult. So
But
breathing.
possible.
Yes, breathing, swallowing and chewing and all of that at the same time. It's so automatic to us that we lose our way. It's like we sometimes have to go back for physical therapy of the tongue and the whole tongue box and the lips and the chin and all of that. So
Well, very informative. A lot to cover in that one and still a lot to dive into. So again, if you have any questions, especially if you're watching on Facebook or Instagram, please be sure to leave a comment for Dr. Susan Maples and she would be happy to respond. And then join us.
It's my life's passion right here.
Yes.
Healthy kids, but this area is a lot for people just because it's something they haven't really been exposed to.
No.
So yes, I would be happy to help you personally. So just give us a holler and we'll answer some questions.
And then of course you can always visit her at her practice in Michigan and get the best on this.
Partners facing are super committed to it. I've got colleagues around the country too that have airway only practices for kids.
Yeah.
There aren't a lot, but they are a really awesome, dedicated group of clinicians. So I can help try to find you someone as we did for you, Lauren. So, yeah.
All right. Well, be sure to join us next time as we dive in deeper yet to this topic in our next episode about sleep. And thanks so much for joining us today.
Bye-bye, everyone. Bye for now. Thank you for listening to the Brave Parent Podcast with your host, Dr. Susan Maples, author of Brave Parent, and Lauren Eckert, founder of Burning Soul Press. Be sure to leave a podcast review and grab your copy of Brave Parent on Amazon or Audible or wherever you choose to buy your books. Bye for now.